Okay, so now we're going to talk about surfaces toward and away. This is important whenever you're treating, not necessarily as much for exploring and probing, but treating when you're going to be doing things where you're using lateral pressure. I mean, specifically scaling and some things like that, where you need to get the right angles and the right amount of lateral pressure, but then also where you need to access things correctly. So it helps with your treatment of people. And so whenever we talk about surfaces toward and away, you always determine what those surfaces are from a certain spot. So right-handed people are always going to determine what their surfaces toward and away are from 8 o'clock. And then left-handed people are always going to determine their surfaces toward and away from 4 o'clock. If you sit at 12, it's not going to be the same, and it's not going to be the same spots. It's going to be incorrect. So you have to sit down toward the bottom of the chair and face up toward the patient's head to be able to determine those accurately. Whenever we're talking about anterior teeth, I've got my example here. So anterior teeth only, we divide the tooth in half. So if you're sitting down in your chair position and trying to determine what are the surfaces toward for you, we've got these lines here. It's all of those halves of the teeth that are closest to your body. The surfaces away are the teeth that are away from your body or away from you. Surfaces toward, I want you to note that they change. It's distals, but then once you cross the midline, it's mesials. So you need to make sure it's the one that is toward your body. It's the same on the facial as it is on the lingual. So you see we've got these colored in inside here too. Those are the surfaces that are toward my body. And one thing I like to think about whenever I'm treating people or whenever I'm talking to people about surfaces toward and away, let me see here. You always want to be treating so that your dominant hand is working toward your non-dominant hand, like this direction. You don't want to turn it backwards and go this direction. So can you already see with my posture and my neutral posture and positioning that going this way is a lot more comfortable than turning and going this way? So these chair positions and surfaces toward and away are going to arrange you so that you're working in the right way and you can get the correct angulations. So anterior teeth, you divide in half. Now posterior teeth are going to be different. I'm going to show you on the typodont in a minute too. Posterior teeth, it's the entire side of that sextant that is toward your body. So like this maxillary right and this mandibular right, where I'm standing right now, are toward me. They are things I can see without using the mirror. And then I open the mouth. This mandibular left lingual and this maxillary left lingual are toward my body. The sides where I would have to use a mirror are the whole sides that are away from me. So let me show you on the typodont. Okay. So it's different for right and left-handed people. You just have to remember to start off in your correct chair position to determine it for you. So for example, a right-handed person who would be sitting down this side of the chair is going to have these as surfaces toward them. And then on the inside, it's going to be mandibular left lingual, maxillary left lingual. So those are the spots where when they are sitting at 8 o'clock, this is toward their body. And then as far as anterior teeth, you divide the tooth in half. So this is going to be a right-handed person's surface toward. Now a left-handed person who's sitting over here, their surface toward is going to be opposite, but it just dictates where you are going to sit to treat appropriately. whenever you're treating, when you treat your surfaces toward, you're going to sit for right-handers down here at more like 8 or 9 o'clock. Left-handers for treating surfaces toward are going to sit more over here for their 4 o'clock, 3 o'clock area. Then for both, whenever you're treating a surface that is an away for you, you move up to 12 o'clock. So then I'm straight up from here rather than being down at the sides. And so as an example, I'm a left-handed person. And so when I'm at 12 and I'm working, I've got my mirror and I've got my Explorer and I'm working. Let's see. I'm working on the sides that are going toward my non-dominant hand. Like I'm working toward my non-dominant hand rather than turning backwards. But now, let's say I'm going to switch to surfaces away. Surfaces toward. So up here were my surfaces away. Down here are going to be my surfaces toward me. So I'm going to come down to my 4 or 3 o'clock position, and I'm going to work on the opposite sides of the teeth, working toward that non-dominant hand. So key items: always determine surfaces toward and away for left-handers from 4 to 3 o'clock area, right-handers 8 o'clock, 9 o'clock area. Whenever you treat your surfaces toward, it is also from that same spot down lower on the chair. When you treat surfaces away, you come up to 12. Divide the front teeth in half. For posterior teeth, it's the entire side.